Good afternoon. My name is Lieutenant Rich Chapman. I'm here today on behalf of Fire Chief Sarah Boone. Thank you for joining us with this virtual press conference. I'm excited to introduce a new online resource to help people assess their health during a time that's become increasingly uncertain and difficult because of coronavirus. The new tool is called C19Oregon.com. It's a free online symptom checker developed by Vital Software, a firm based in Atlanta, along with local tech partners. This tool is currently available to the people of Portland as well as those living in Multnomah, Clackamas, and Washington counties. To date, approximately 500,000 people in 26 countries have used it. How does it work? I'll give you a demonstration in a moment, but in short, people click on C19Oregon.com and answer a few simple questions. This includes their age, their zip, how they're feeling, and whether or not they have pre-existing conditions. Based on the response, the symptom checker generates a green, yellow, or red assessment to help them get the appropriate level of care. Green, you'll see, indicates the lowest level of health risk. It directs folks to stay at home and monitor their progress, check for fever. If you get yellow at the end, this is a moderate level of risk. People should, among other things, stay at home, call a primary doctor for an over-the-phone consultation. By the way, if they don't have a primary care doctor, they'll be directed to other resources to find care. Red is the high-risk category. It urges people to seek medical attention while warning inbound doctors and hospitals so they can be fully prepared. To be clear, if people need medical help and their local hospital is experiencing a surge, the tool will send them another facility where they can get treated quicker. In other words, C19 Oregon directs the right resources to the right place at the right time to help the greatest in need. So with that, I'm going to actually show you guys a quick demonstration of how this works. So hopefully you guys should all be looking at the screen here. That is the homepage for the coronavirus checker. And you can see here, it's pretty simple. You basically just enter your age, your zip code, and you get a list of questions. So basically, I just want to explain that, to be clear, people, I can't actually emphasize enough just how important this concept of getting people to the right place at the right time. For those of us that work in emergency care in the medical systems, emergency rooms, ambulances, treatment facilities, the key to saving lives often comes down to having the right resources on hand. By closely tracking the spread of this disease, we can also better protect doctors, nurses, paramedics, and other frontline healthcare professionals, ensuring they have access to the PPE that they need. Before I introduce the next speaker, I'd like to just say that these are rough times for a lot of us. And sadly, some families have already lost loved ones. Others may be sick or scared. If you're experiencing symptoms and asking yourself, what should I do next? How can I keep my family safe? I encourage you to use and visit C19Oregon.com from the safety of your own home. The tool is extremely user-friendly and will provide you with the latest information from the World Health Organization and Centers for Disease Control. It will also give you quick access to the address, phone number, and hours of nearby medical facilities, emergency, non-emergency numbers, and other resources. It's important that we catch people that oftentimes fall between the cracks. And so this info is available in 15 languages, and it's screen reader capable for the sight impaired. We know this tool is a work in progress and we'll certainly need to refine it. In the meantime, however, we hope it helps people get the guidance they need while giving emergency medical responders the data required to track and contain the disease. At this time, I'd like to invite Dr. Ritu Sawhney, Medical Director for both Clackamas and Washington County. Thank you for coming, Dr. Sawhney.
Thanks, Rich. Thanks for having me. As medical director for EMS medical director for Washington and Clackamas counties, I think it's important to point out that while EMS is sort of managed at a county level, we really do run it as a regional EMS approach. Our quality of care markers and the protocols that our providers use span the entire region. And so we felt it was very important that a solution like this also be regional, so that everyone in our community is using kind of the same set of standards and guidelines. From an emergency response perspective, it really gives our patients and our community the tools they need to keep themselves safe. And, you know, there's a lot of information out there about this disease, some of which can be quite confusing, sometimes contradictory. And we feel that this tool, which is based on the best evidence out there in terms of who's at risk, will really allow our patients and our community to have a resource to help them decide kind of the best place for them to go for their, or the best way to seek care. It would allow for patients to stay out of the 911 system if they don't need to be there. It would also allow patients who although they feel sick, may not actually have the disease. It would prevent them from exposure to the disease if they went to the emergency department. It allows also for proper utilization of other resources such as outpatient clinics. And then we also have all of our healthcare systems with a virtual component now doing telehealth and telemedicine, which I think can be quite beneficial for our patients who are not as seriously ill. So from my end and my perspective, I think this is a great opportunity for us to work together as a region, to work with my partner, Dr. Ju, as well as all of the medical directors in our system for all of our EMS agencies to ensure that really, as Rich said, the right patient is taken care of at the right place and in the right time. So with that, I just want to turn this over to Dr. Jennifer Vines. Dr. Vines is the Multnomah County Public Health Officer.
Thank you. Thank you both, and good afternoon to everyone. I just want to say I'm so appreciative of the work that our first responders and EMS medical directors have done to bring this tool online. I was a young health officer for the 2009 H1N1 pandemic, and excuse me, we literally had a piece of paper with red, yellow, excuse me, with red, yellow, and green categories that signaled how sick somebody needed to be and where they should seek care depending on how ill they were. So I really feel like this is a 21st century version of that. And again, I'm really grateful. I am looking at this tool from a public health standpoint as part of our preparations for a wave of illness that may yet come to our community. The most recent models are predicting late April or early May. And people like me and many others are working hard to continue to make sure that we have no gaps in our planning, and to make sure that, again, that people get the right care at the right place at the right time. So this is an important tool. I will say that there's reason to be optimistic that our social distancing and physical distancing has helped. I would like to urge people to continue their efforts. We are doing well. The sun is out. And I certainly recognize the importance of getting outside for physical activity and to get fresh air. Just please do so safely. And that means maintaining at least a 6-foot distance from anyone who is outside of your household or outside of your immediate social circle. So again, please be safe outside. And finally, for anyone who does not have health insurance or who uses this tool and it is unsure where to go next or concerned about insurance, we do have community health centers that are open and taking patients, and you can call 211 or visit your county's website for more information. I think with that, we'll open it to questions.
Ask questions. So if reporters want to just raise their little blue hand, they can do that and ask a question that way. You can also chat if that's easier for you. Emily, hi. Let's see. Yes, Emily Higgins. Hold on, let me find you, Emily. I'm gonna unmute. Let's see, Emily, you should be able to talk.
Hello. So, yeah, Sarah Hurwitz with Channel 12. Emily Higgins is my photographer. We're logged into hers. My question had to do with, fear. So we have so many people, right, that might have one symptom or 2 of 5. And I feel like a lot of people are walking around going, do I have it? Do I not have it? Is this kind of an attempt to help folks get clarity in all of this and maybe give them more of a sense of control of their own health and what to do next?
Yeah, I think I can answer for that one. That's exactly what we're trying to do, Sarah. We are, for instance, I have friends that'll send me a text, hey, I've got a fever of 99 degrees, 99.4 degrees, and I've got a little bit of a cough. Should I be worried about my symptoms? And it's actually an easy way for me to just say, hey, try this website out real quick and tell me what results it gave you. At the very end, it gives you that color, red, yellow, or green. And I can actually just ask them, like, what color do you see at the very end? And I kind of get an idea of just how severe their symptoms are based on this algorithm that was built by the CDC. So that's really important to understand. This isn't here to like replace a doctor. This is not the end all to understanding whether or not you have coronavirus. This is a symptom checker, and it's an algorithm that was agreed upon by the CDC as being an approved algorithm. By that I mean the questions are appropriate, and if you answer these questions, you most likely are at whatever level of risk that it tells you at the very end.
And I think Lindsay had a question around tracking. Lindsay, you're unmuted.
Thank you. Yeah, Lindsay with KGW. I was just wondering who's keeping track of this data as people go in and answer questions, and how will it be used?
So I can answer that one also. The company Vital Software, they're Atlanta-based, and they've been using this app, or excuse me, this particular website with over 500,000 patients so far, and they have a system at the end where you can voluntarily add your contact information, but otherwise there's no contact information kept. The data itself is usable for us at the well, I guess actually more for Julie and her colleagues at the health department level, because it actually can show based on zip code where we're starting to see certain type of symptoms pop up. Yeah. So that's something that will be available to the physicians that monitor that kind of thing. And from our end, it'll be a good indication as to whether or not we need to change some of those destinations. So for instance, if we have areas in, we'll say Tigard in Washington County, if we start seeing a lot of red patients pop up in that area, red or I mean critical patients, we can actually provide warnings to the emergency room there and actually get reports from those emergency rooms in that area as to whether or not they're being inundated with patients. And if they are, we can start directing people to different emergency rooms. And that's really that's the key component there. Is in some of these areas like you're seeing in New York, folks or some of these hospitals are being overrun not only by very sick people, but by people that are anxious about their moderately sick symptoms, which is understandable, you know, considering all the chaos that's going on there. I hope that answers your question.
Can I just add something?
Yeah, please.
Yeah. So this is Dr. Sani with Clackamas County and Washington County EMS. I think that as an EMS medical director, one of the things that I do is review data of our system pretty much on a daily basis. And we're daily looking at our call volumes, of patients who may have symptoms that are consistent with this pandemic. And so even before we get to the point where somebody's overrun, our hope is that if we can see a spike in usage of this tool in certain regions or area, so that would be sort of an earlier warning that a surge is upcoming. So rather than responding to a surge, we're better anticipating the surge. And so we're hoping to have access to that data as quickly as we can.
Anybody else with questions? You can chat me. Yes, you may, Lindsay. Hold on just a second. Let me unmute you. Lindsay, you are unmuted.
Thank you. I'm just wondering, could this data help show the need for more testing, and could it be used to get more testing? I personally know people who have had doctors tell them, yeah, it sounds like you have it, but we don't have enough tests to test you, which again shows, I guess, a need for something like this so people can really go through those symptoms, but could ultimately help us get more tests.
So I can take a stab at that one. I think testing has become actually a difficult question. It's come online now as a diagnostic test. That means, though, that it's a snapshot in time, and no test is perfect. So we're trying to figure out how best to use the test to help manage the outbreak. I completely understand why an individual person would want to know their status. But from a public health standpoint, whatever your respiratory symptoms that lead you to testing, if you're okay to stay home, then you're unburdening the healthcare system, and you're doing the precautions as if you have COVID-19, which is to stay home for until 72 hours have passed since your fever is gone and your cough is clearly better. So there's a lot of discussion now in public health about how to use testing as a tool for public health, completely understanding that individuals will want to know.
Thank you. And Lachey, you had a question. I unmuted you, Lachey. Let me try unmuting you again. See if that works.
Okay, sorry, I muted myself. My question is, how quickly does this information come through? Where does it go? And will it update? I mean, how will we be updated? Will it be, I mean, will we have like a better idea of possibly who might have this virus through this possibly? I know it's been hard with the limited testing.
Did you have an answer? I'll just maybe answer on the piece about, actually, Lachey, can you repeat the first part of your question? There was a piece that I wanted to answer, and maybe we're not able to do that.
No, so my first question was just how quickly will you be updated, and how will that information be generated? How quickly will you know, basically?
So that piece of it I can at least answer for you. It's one detail I don't think we've mentioned is this project started about 14 days ago. So in this, you know, this is the world we live in right now. We're hurrying with projects like this. We have agreed upon 6 to 12 hour intervals at this point, but as far as how we get that out to media, we asked a little bit of patience as we're like really trying to figure out, once we get this data, how we put it in a presentable form so that people can see it. We ultimately, we certainly want to share it. There's, I think, a lot of benefit to that. And there's been some great dashboards in Multnomah County and Oregon, OHA have also put up that I think are really beneficial, and information makes people feel good. I mean, there's no reason to hide any of this stuff. So we're certainly hoping to get that stuff out in a very usable and readable form as soon as possible. It just may take us a few days here.
And I think there was a second question that had to do with kind of understanding, using this tool as to understand about where this is in our community or how involved. And I think that it's just too early to know. This is a new tool, and we'll just have to see what kind of data we get back and what the quality of that data is. And that before we can sort of use it to apply to how widespread or how much actual disease we have in our community.
Yeah, and I'll just chime in from a public health standpoint. We have several sources of data, and everybody loves data, and data is a lot of work, especially to interpret. So again, I'm excited to have this in our toolkit, and I'll be interested to see how it matches up with some of our other public health tools like modeling, like our real-time case investigations. So yes, so more. I'm guessing more to come.
Great. Yes, Lindsay, let me unlock you. Lindsay has a question for Dr. Vines. Okay, Lindsay, you should be able to go ahead.
Thank you. Yeah, Dr. Vines, I was just wondering, so you said, we think it's 72 hours after you're not showing symptoms to stay home. Are you guys looking at the possibility that it's longer? Because there was a woman who lives in Forest Grove I did a story with, and she only had symptoms for a week, but in Japan, she was in the hospital and continued to test positive, I think, for 3 weeks after she didn't have any symptoms. Are you concerned that the period is longer and people should be staying home longer after they don't have any more symptoms?
Yeah, thanks. That's a great question. It's true that this criteria is not going to capture everybody who is completely free of the virus 72 hours after improvement of their symptoms and resolution of their fever. We think that it's going to capture most. So there are certainly stories about people who continue to test positive for the virus well after 72 hours. It's not clear how infectious they are at that point. And this is Centers for Disease Control criteria that we look to, again, that we think is practical and that is going to capture most people as far as the end point of their true infectious period.
Okay, thank you all for joining us. And are there any last questions before we let folks go about their day? Yes, Lachey, hold on. Let me unmute you. Lachey, go ahead.
Yeah, Dr. Vines, can you talk about false negatives, and do you know if this tool might help with that issue?
So thanks. I think by false negative, you're referring to the current diagnostic test, which is doesn't always give a reliable result, and no test is 100% either way. No test is 100% positive in all cases and 100% negative in the absence of the virus. So you're raising a concern that others have as well, that the diagnostic test we have right now may be a false negative, which means it may not detect infection in someone who is infected. I think that is an issue, which is another reason why we're trying to figure out the role of testing from a public health standpoint in our response. It also leads us back to just some very practical criteria around symptoms, staying home when you're sick, potentially using this tool to figure out if you need care, and otherwise considering yourself no longer contagious, again, 72 hours after your fever has gone away and your symptoms are clearly better.
Awesome. Thank you all for joining us today. I think that will close out the meeting.